Welcome to the Heartbeat Podcast, your trusted source for the latest breakthroughs and insights in cardiology. Here, we uncover the science behind every beat, bringing you cutting-edge research, expert discussions, and innovative approaches to heart health. Whether you're a medical professional, a curious learner, or someone passionate about understanding the heart's complexities, you're in the right place. So let's dive into today's episode and explore the pulse of modern cardiology together.
Hey everyone, and welcome back for another deep dive. We're tackling cardiology today.
Ooh, exciting.
I know, right? Specifically, we're looking at colchicine for heart attacks. You know how we've been hearing about how it could be helpful?
Right.
Well, there's this brand new study that basically says, hold on, not so fast.
Oh, wow.
Yeah, it kind of throws a wrench in the whole thing.
Really?
Yeah. And it was just published today in the New England Journal of Medicine.
Wow, hot off the presses.
Seriously, hot off the presses. So
we're talking cutting edge stuff here.
This is like the forefront of research right now.
Absolutely.
Before we get into all the nitty-gritty details, I wanted to introduce...
Oh, yes, please introduce.
...the amazing expert we have with us today.
Well, thank you so much for having me. I'm excited to unpack all this with you.
All right, so let's rewind a bit for our listeners who might not be totally familiar with colchicine.
Sure.
Can you give us like a Coles Notes version of what it is and what we thought it did?
So colchicine is a drug that's been around for ages, mainly used for inflammation, especially for gout. You know, that really painful joint condition.
Yeah.
And, well, inflammation is a sneaky culprit in heart health, too.
Really?
Oh, yeah. It's like after you have a heart attack, your body's natural response, which is inflammation, it can actually cause even more damage to your heart.
So it's kind of like your body's trying to help, but it backfires.
Exactly. It's like it overdoes it a bit, you know?
Wow. So that's where colchicine comes in.
Right. So researchers were super curious if colchicine, because it's so good at tackling inflammation, if it could help protect the heart after someone's had a heart attack.
Interesting.
And there were some earlier studies like the Colchicine trial and the Lotus CO2 trial.
I've heard of those.
Yeah. They showed some really promising results. Like colchicine could maybe reduce the risk of another heart attack, stroke, or even dying from heart problems.
So it seemed like a potential game changer.
Oh, absolutely. People were getting really excited about it.
I remember reading about it.
But now we've got this huge new study, the CLEAR trial. And it throws a bit of a curveball.
Okay, now I have to know more.
So picture this. Massive research project. Over 7,000 patients.
Wow.
From 14 countries.
That's huge.
Huge global effort.
Yeah.
And everyone in the study had recently had a heart attack.
Okay, so they took all these patients and...
They split them randomly into two groups.
Okay, classic trial setup.
One group got the colchicine and the other got a placebo, basically a sugar pill.
So like a dummy pill.
Exactly, just to make sure everything's fair.
Got it.
And then they watched them closely, followed them for a while to see if the colchicine group did any better in terms of avoiding another heart attack, stroke, or serious heart problem.
All right, so everyone's waiting with bated breath. Did it work?
Well, that's where things get interesting.
Oh, boy.
This massive study found that colchicine, when given after a heart attack, it didn't actually reduce the risk of those major heart events.
Wait, hold on.
Yeah.
So all that excitement, all those earlier studies,
I know, right?
Are we saying they were wrong?
Not necessarily wrong, but this new evidence from such a big study, it definitely makes us question those earlier findings.
Okay, so this is where I start getting confused. Like, we've got this massive study saying one thing, but then these other studies saying something else.
I know. It's tricky, right?
How do we make sense of all of this?
Well, there are a few things that could explain why the results are so different.
Okay, like what?
Well, for one, the patients in each trial might have been different in subtle ways.
Like how so?
Well, maybe people with more severe heart attacks don't benefit as much from colchicine.
Oh, so it could work for some people, but not others.
Exactly. And then you have to consider the trials themselves, how they were designed.
Okay.
Things like how long they gave the colchicine for, what dose they used, and even what specific outcomes they were looking at.
So it's not always apples to apples.
Exactly. It can be really hard to compare studies directly.
Yeah, that makes sense.
But the thing is, this CLEAR trial is one of the biggest, most rigorous studies we've got on colchicine. So while it doesn't totally wipe out those earlier studies, it does raise some big questions.
Okay, so what does this all mean for the average person listening?
Right.
Like, let's say someone's taking colchicine for gout. Should they be worried?
That's a great question. And it's important to remember this study was all about colchicine after a heart attack.
Right.
It doesn't necessarily apply to other things colchicine is used for.
Okay.
So if you're on it for gout, don't panic. Don't change anything based on this one study alone.
That's reassuring.
Definitely talk to your doctor if you have concerns, though.
Always good advice.
Always.
But I imagine this is going to have cardiologists scratching their heads a bit.
Oh, absolutely. This study gives them a lot to think about, like weighing the potential benefits of colchicine against the risks.
Yeah, and speaking of risks, didn't this study find that colchicine increased diarrhea in some patients?
It did, yeah, which isn't fun.
Not fun at all.
But it's not life-threatening.
True.
And on a positive note, they didn't see an increase in serious infections, which was a worry from earlier studies.
So kind of a mixed bag on the side effects front.
Yeah, it's not a simple story.
Well, one thing's for sure, this study is really shaking things up.
For sure.
Like, even though the results weren't what people expected, we're learning a lot.
Absolutely, and that's how science works.
Right. It's all about pushing the boundaries of knowledge.
Even when a study doesn't give us the answers we hoped for, it still moves us forward.
Couldn't have said it better myself, so even though colchicine might not be the magic bullet we thought,
right,
there's still a lot to unpack here.
So much to learn.
We'll be back in the next segment to dive deeper into what this all means and look at some other promising research in this area, so stay tuned.
Looking forward to it.
Okay, so we've established this clear trial is a pretty big deal.
Definitely.
But I'm still kind of stuck on the why here.
Yeah.
Like, if colchicine reduces inflammation, shouldn't that be good for your heart?
You would think so, right?
Yeah.
And that's what makes this whole thing so fascinating.
Uh-huh.
It really shows how complex inflammation is.
Okay.
You see, we know that long-term inflammation, it's linked to heart disease.
Right.
But that doesn't mean that just lowering inflammation automatically means better outcomes.
So it's not as simple as inflammation bad, less inflammation good.
Exactly. It's way more nuanced than that.
Okay, so how do we explain this?
Well, in this study, even though colchicine did lower those C-reactive protein levels,
which is a sign of inflammation, right?
Exactly. It's a marker we use.
Yeah.
That reduction didn't actually lead to fewer heart attacks or strokes or any of those major events.
So it was doing something, just not the something we were hoping for.
Right. And there could be a few reasons for that.
Like what?
Well, first off, inflammation is this intricate process with all these different pathways involved. And colchicine only targets one specific pathway. But there might be other inflammatory pathways that are contributing to the heart disease risk.
So it's kind of like you're trying to fix a leaky faucet.
Yeah.
But you're only tightening one screw.
That's a great analogy. There could be leaks you're missing.
Exactly.
And then there's the timing to consider.
Okay.
Maybe giving colchicine right after a heart attack.
Yeah.
It's too late to make a real difference. Perhaps starting it earlier before someone even has a heart attack might be more effective.
That's an interesting thought.
It's something to consider for future research, for sure.
So the takeaway here is that just reducing inflammation isn't some kind of magic solution for preventing heart problems.
Exactly. It's not a one-size-fits-all situation.
Got it.
We need to understand how those different inflammatory pathways, how they actually play a role in heart disease.
And target them specifically.
Exactly. We need to be more precise.
So where do we go from here? Are researchers just giving up on colchicine for heart health?
Oh, not at all. This study just gives us another piece of the puzzle.
Okay.
Remember, it was specifically looking at colchicine after a heart attack.
Right.
It's totally possible that colchicine could still be useful in other situations.
Like what?
Well, like preventing that first heart attack.
Interesting.
Or maybe treating other heart conditions.
So there's still a lot more research to be done.
For tons. This study, even though it was unexpected, it actually opens up all these new avenues to explore.
Like what kind of avenues?
Well, researchers could look into different dosages of colchicine, or try giving it for different lengths of time.
Okay.
Or maybe even combining it with other treatments that target those other inflammatory pathways.
So it's like they're trying to tackle this problem from all sides.
Exactly. Trying to find the most effective way to manage inflammation and protect the heart.
That makes sense. So this clear trial, it's not the end of the story.
Definitely not. It might be just the beginning.
And it's not the only research happening in heart health, right?
Oh, no. There's so much going on.
Like what?
Well, they're looking at other anti-inflammatory drugs like canakinumab.
I've heard of that one.
And methotrexate to see if they can help prevent heart attacks and strokes.
Interesting.
They work a bit differently than colchicine.
Okay.
So they might be able to target those other inflammatory pathways we talked about.
So different tools for different jobs.
Exactly.
And are there any other big trials going on?
Oh, yeah. There are some really exciting ones like the Artemis trial.
What's that one looking at?
Well, they're testing totally new approaches to preventing heart disease.
Wow.
Some of them are focused on lifestyle changes.
Okay.
Like diet and exercise.
Makes sense.
While others are looking at genetics.
Oh, wow.
And personalized medicine.
So it's like a multi-pronged attack on heart disease.
Exactly. It's a really exciting time to be in this field.
It sounds like there's a lot to be hopeful about.
Absolutely.
Even though this CLEAR trial had some surprising results, it seems like we're making real progress in understanding this whole inflammation and heart health connection.
I completely agree. The more we learn, the closer we get to finding better ways to prevent and treat heart disease.
Well said. This has definitely been a really thought-provoking deep dive.
It has.
We started off thinking colchicine was a potential game changer.
Yeah.
But now we're seeing it's a lot more complicated than that.
Definitely.
It just goes to show that science is always evolving.
Always.
And sometimes even unexpected results can lead to really valuable insights.
Couldn't have said it better myself. It's all about embracing the journey of discovery.
Speaking of discovery, before we wrap up this episode, there's one more thought-provoking question I want to throw out there. So this CLEAR trial, it was all about people who had already had a heart attack.
Right.
But what about using colchicine to actually prevent a first heart attack?
Well, that's a great question.
Would it be helpful there?
Yeah, even if it's not as effective after the fact. That's a really interesting thought.
Yeah.
And honestly, it's something that CLEAR trial didn't really look at. So it's definitely an area ripe for more research, you know?
Yeah.
It's like we opened one door, found something unexpected, but right next to it, there's another door just begging to be opened.
I love that. So this study might kind of close the door on colchicine as a treatment after a heart attack, but it could open a whole new path for preventing them in the first place.
Exactly. And it really emphasizes how important it is to keep studying inflammation and heart health.
Yeah.
Even if colchicine isn't the answer for every situation.
Right.
Figuring out how to manage inflammation.
Yeah.
That could be the key to finding better ways to prevent some heart problems.
Okay, so let's take a step back for a second and sum all this up for our listeners.
Okay.
What are the big takeaways they should remember from this deep dive?
Well, first and foremost,
Yeah.
this big, well-done CLEAR trial, it showed that colchicine,
Yeah.
when you give it after a heart attack,
Uh-huh.
it didn't really lower the risk of those big heart problems, heart attacks, strokes.
Yeah, a bit of a surprise.
It really challenges what we thought we knew from some of those earlier, smaller studies.
Okay, what else?
Second, even though colchicine did lower inflammation.
Right, we saw that with the C-reactive protein.
Exactly.
Yeah.
That didn't actually translate into fewer heart attacks or anything like that.
Interesting.
It really highlights how complex this relationship is between inflammation and heart health.
It's not a simple fix.
It's not, you can't just assume less inflammation automatically means a healthier heart.
Got it.
And the third thing to remember, this study was specifically about using colchicine after a heart attack.
Right.
It doesn't change how we think about using it for other things, like gout.
Okay, good to clarify that.
So if you're taking colchicine for gout, no need to worry or change anything based on this study alone.
Always talk to your doctor.
Exactly. They can give you the best advice for your specific situation.
Well, I don't know about you, but I'm feeling pretty energized after all this.
Me too.
It's amazing how one study can spark so many questions and new avenues for research.
Absolutely. It shows how dynamic science is, always pushing forward.
Totally agree. It's all about staying curious and open to new discoveries.
Couldn't have said it better myself.
Well, that brings us to the end of our deep dive into colchicine and heart health.
It's been a fascinating journey.
It has. We encourage everyone listening to check out the full study in the New England Journal of Medicine.
Yeah, if you want to dig into the details.
And as always, if you have any questions or concerns about your own health,
talk to your doctor.
They are the best resource for personalized advice.
Absolutely.
Thanks for joining us on this deep dive. And remember, knowledge is power.
Thank you for tuning in to the Heartbeat Podcast, where we uncover the science behind every beat. If you enjoyed this episode, don't forget to subscribe to the podcast on your favorite platform to stay updated with our latest discussions and insights. We'd love to hear from you. Share your thoughts, feedback, or questions, and let's continue exploring the pulse of modern cardiology together. Until next time, take care, stay curious, and keep your heart healthy.